The difference between local anesthesia and sedation anesthesia or general anesthesia is the fact that with local anesthesia, it is only anesthetic of the area where we're working. The patient is not sedated, the patient is not asleep. And so what that means to the patient is that when we use a local anesthesia technique, we have to inject the anesthetic into the patient while they're awake, and so that translates into discomfort. Now, what I tell patients when we use a local anesthetic is, depending on the area that we're going to inject, the discomfort is very short-lived. Most of the time when we use a local anesthetic, the discomfort doesn't last more than 3 or 4 minutes. So we perform a lot of procedures under a local anesthetic, and it's a great way for patients that are concerned about the side effects of sedation or general anesthesia to have these procedures. However, patients need to understand that there's always discomfort on the front side from this procedure. We can complement the local anesthetic with laughing gas, for example. And a lot of patients choose to do the laughing gas because it basically makes them feel like they don't care while the local anesthetic is going in, and they don't remember as much of that part of the procedure. But once the local anesthetic is in, patients don't feel any discomfort. Local anesthesia is used a lot by dentists. When you go into a dentist and have a filling placed, the dentist will give you a shot, and that area will be numb, and it allows the dentist to go to work. For patients that are a little more on the anxious side and don't want to know what's happening and they want to be completely asleep, the way to go is with the use of the twilight anesthesia or the general anesthesia. In these situations, patients are completely out. They have no recollection of anything that happened during surgery, and we manage all of their functions such as their breathing and everything else that comes along with it. We have a very low complication rate with anesthesia in this practice, which means that patients wake up very quickly and they're able to go home very quickly after the procedure. So it's a great way for patients who are anxious or worried about being a little too anxious during the procedure to have these procedures done with minimal downside.